TAG, You're It, Medical and Health's Role in Emergency Response. Episode 5, Wrapping It All Up, Disaster Recovery and Lessons Learned. Swift resumption of day-to-day life is essential to the stability and well-being of impacted communities. Disaster recovery, mitigation, and continuity of operations in government, COOP and COG plans ensure critical services are maintained and/or resumed as soon as possible. These plans serve to expedite the return to normalcy.
There's just nothing like a disaster that was the magnitude of the Camp Fire, that just because the shelters are closed and your public health emergency response has finally ended, you still are helping your community recover for their health care for years to come.
Yeah, I mean, we lost 25% of the skilled nursing beds in the county, and we still don't have them back. We're talking to public health people so I can talk about these kind of topics. But in recovery, there's a lot of things, and in evacuation, there's a lot of things that don't occur to people.
There were definitely FEMA case managers who came, coming to help with, meeting with people who had lost their homes, trying to help them get housing immediately, and then, of course, working on their long-term care. But for FEMA, afterward, we actually had a team from Joplin, Missouri, who had lost
Town.
the whole town, kind of like Paradise had. And they came specifically to try to address any needs that the children and the schools had. So that was just one example of programs you may not be aware of, resources you may not be aware that FEMA has, that they offer and send to your community.
Yeah, I would say that most of the federal resources are, like Monica described, we're very involved in the recovery part.
The needs of the incident change as it progresses from the immediate response to the recovery and the mitigation phase.
Recovery comes after response, right? So you're so buried in response and getting all you can do to literally save lives completed, that recovery is at least at that point in time, it's just not something you're looking at or you're figuring out. And luckily, we had lots of team members at the SOC. We had our OES partners, we had our CDPH partners. We were very operational and response-oriented, and lots of our partners could bring to bear the recovery piece.
One of the very first lessons that was instilled in me as an emergency manager was we start thinking about recovery as soon as we get into a response.
Recovery starts right the same time that response does. And why is this? Well, because the recovery part has to do a lot with reimbursements and getting people back to their homes and all of this. And the sooner you start that, the easier the transition is, right? Of course, we're going to have the response. We've got to put out the fires. We've got to address but it's recovering from the incident is just as important as responding to it.
Recovery to mitigation. It's one of those, the fluidity of the emergency management cycle is quite varied, and we get a little bit stuck when it comes to mitigation sometimes. Is it an afterthought? Is it a before thought? And definitely as part of, after action reviews, identifying, especially if it's something that repeatedly happens, how can you make that not happen anymore? If you're able to prevent a catastrophe from happening or lessen the impact of something, that's definitely a place that you want to invest.
Continuity of operations is something that I've become a huge believer in, particularly post-COVID. And I've always believed in it. We developed COOP plans, but I saw firsthand how important it was as part of the COVID response. During COVID, we saw we had to redirect almost all of our staff to be able to respond to the pandemic. But what does that mean for our critical services that have to continue? So doing COOP planning allowed us to think through, what does that look like? How many staff do we need to keep the most critical functions going for the health department? So again, COOP is all about keeping services going.
Workforce capacity and COOP planning, ensuring that you have the necessary workforce capacity during an emergency. Knowing that you can build in and have depth on your bench is going to be very beneficial when you're responding.
COOP and COG can be for a lot of different things besides even the traditional emergency response. COOP and COG is to identify your essential functions and what it takes to bring them back online. COOP and COG really has you lay out that succession plan as well. Like part of it is, okay, if this person's not available, who steps in? And so laying that out for each of the essential functions as well as, and even for the directorate.
Continuity of government is also critically important because there are certain authorities that rest with, for example, the Board of Supervisors or City Council in a city jurisdiction. If we don't have continuity of government and those individuals aren't able to meet for whatever reason, there are so many things that can't happen. And so it's critical for us to think through how do we transfer authority? Who's in charge if the CEO is not available, if the board chair is not available, if the finance director isn't available, and really think through that so that we aren't hampered during an emergency response.
Part of the recovery and mitigation process is conducting formal and informal post-disaster hot washes and surveys to identify successes and challenges. These findings will support the creation of a formal after-action report, AAR, and improvement plan, IP. Learning from past successes and mistakes is critical to ensure constant and future improvement in emergency response.
One of the things that to me is really helpful in a hot wash and then the after-action report, first and foremost, primarily, is just helping you as the responder to process that information. And when I say process it, I mean in a few different ways. First is just personally, you have to be prepared to kind of relive it as you're going through the hot wash. You know, not just what you did, how you did it, but trying to take a step back and look at it critically. What went well? What were we prepared for? And it went according to plan. And what caught us off guard? What could we have done better? What could we learn from so that the next time we'll be ready?
We also had a lot of small fires. So when we went into the shelter atmosphere, each one of those fires, we wrote an after action report, which includes a corrective action plan. Those corrective action plans allow us to look at what were the strengths, what were the weaknesses of our response. We were able to take those and make recommendations for the future and build upon each and every response.
Those after action reports are only usually helpful to your own department. And when you have events as large as, say, COVID or even the Camp Fire, there's an additional, I think, responsibility and challenge to try to take the challenges and if there are lessons learned to a larger audience so that not everyone has to live through those to start to learn the lessons.
Become a subject matter expert in as much as you possibly can. I'm not saying everything's going to be in your head. It's never all going to be in your head. Know what's in your head, know where to look up information, know who to call, and insert yourself into the process as it exists in your county. Know your county's response structure. Know what your place and what your role might be in an EOC. And if you're a subject matter expert in some things, you will earn the right to be present in that response. And that's incredibly important that you need to do that.
Don't be afraid to try new things. Like I said, I came into public health with zero background of the topic itself, but I knew that I could communicate. I knew that I was a hard worker and a fast learner, and I knew that I was passionate about the topic of health. So you can try new things, and you can succeed.
I've been doing this for 27 years, and there is plenty that I don't know. And so I will always be training, trying to get better at whatever job I have. And that's what I hope everybody that watches this video does. You're never going to be an expert on everything. So find something in this job or whatever your job is to make yourself better.
this is such a fun job to have. The ability to just learn and engage and work with different partners that maybe you wouldn't work with on a regular day-to-day basis. Remaining flexible and adaptable is the key to life in emergency management.
I love public health. I love emergency management. I believe in the MOAC program. I believe in the RDMHC program. I believe that we can work collaboratively, and I think we have to because our communities are depending on us to protect them.
My parting words of wisdom is for people that have public health nurses working in their jurisdiction. Your public health nurses are one of your best resources in times of a disaster. Use them and then thank them after the disaster is over.
Thank you for everybody who's involved in this work, because it's hard work, it's long work, and it's invaluable in terms of the people who come into this and really care about the response.